All right, welcome to our final review lecture for abnormal psychology. I'll be going over 50 topics, and these 50 topics will coincide well with your final exam. So let's get started. The first topic is anorexia nervosa. You want to be familiar with symptoms, the way individuals suffering from this disorder tend to think, how they view themselves, and any other pertinent information related to anorexia. Topic 2. Topic 2 is specific to pedophilia. This was a paraphilia that we discussed. I would like you to be familiar with diagnostic criteria for pedophilia and also any other types of pedophilia we may have discussed in class. Third topic. The third topic is about being awareness of or having awareness of sexual response cycles. What is the typical sexual response cycle for a male? What is the typical sexual response cycle for a female? Topic 4. You want to be familiar with various anxiety disorders, specifically knowing things like acute stress disorder, generalized anxiety disorder, post-traumatic stress disorder. These various disorders should be familiar to you. Topic 5. Topic 5 has to do with paraphilias. You want to be familiar with some of the major paraphilias we've discussed. There were a handful of them, so I'd encourage you to review this material. Things like voyeurism, frauderism, pedophilia, and a host of others we discussed. And topic 6, also in this line of paraphilias. So we spent quite a bit of time on sexual dysfunctions and paraphilias. I recommend a thorough review of both areas. Topic 7. Topic 7 has to do with treatment for institutionalized patients. We discussed several types of institutions in the modern era relevant to schizophrenia specifically. So I would be familiar with these institutional models of therapy. Topic 8. Topic 8 has to do with childhood disorders, specifically the overdiagnosing of children with bipolar disorder. This will be part of our lecture and in your lecture notes, and also thoroughly discussed in your book. So reviewing material on bipolar disorder, and specifically bipolar disorder in children, should benefit you in your review for this topic. Topic 9 also comes to us from the area of childhood disorders. You should be familiar with the diagnostic criteria for attention deficit hyperactivity disorder, any gender differences that may exist in diagnostic patterns, and overall pertinent information related to ADHD. Topic 10 is another question on paraphilias. So again, you want to be familiar with the various paraphilias we discussed in this chapter, or in the chapter we reviewed. Topic 11. Topic 11 relates to substance use disorders. You want to have a solid definition of what is a substance use disorder. You want to know how that is different from substance intoxication. And there were various sections of this chapter that goes into various different use disorders, whether it be inhalants, stimulants, depressants, things of that nature. Topic 12 is on eating disorders. I would like you to be familiar with both anorexia nervosa and obviously bulimia nervosa. And in addition, we talked about binge eating disorder. So you want to be familiar with a lot of terms here. What is a binge? What is a purge? What is a compensation behavior? What are the hallmarks of anorexia? What are the hallmarks of bulimia? So you want to spend some time and have good knowledge for this area. Topic 13 has to do with substances and how they interact with one another. So being familiar with the effects of mixing drugs and how this can have negative consequences. We did talk about some of the favorable uses of mixing substances like drugs and alcohol, but you want to be familiar with some of the negative consequences. Topic 14 has to do with sexual dysfunction. We discussed several male and female sexual dysfunctions, being familiar with each and knowing some of the criteria to diagnose these disorders would be helpful for you. Topic 15 Has to do with treatment for trauma-related disorders. I would be familiar with common treatments for people with PTSD or acute stress disorder, and this might tap into some of our perspectives that we reviewed in the first half of class. Topic 16, another question on eating disorders. So again, you want to be familiar with a whole array of terms relating to eating disorders. Topic 17. Topic 17 has to do with behavioral genetics, family pedigrees, twin studies. In this case, I want to know your familiarity with terms like concordance. And what does it mean to, what does a concordance rate tell us? So that was topic 17. Topic 18 has to do with childhood disorders. So a thorough review of the various childhood disorders should benefit you in this case. Topic 19, this is an in-class question. So I really want to see who's been attending class regularly. I'm going to reference some of the videos we've watched, and hopefully you have taken some notes on these videos and have a good sense of what videos we watched. Topic 20. Topic 20 is psychotropic medications for the treatment of eating disorders. So what are common pharmaceutical treatments for various eating disorders? Topic 21. Topic 21 is another question generally on the subject of eating disorders. Again, you want to be familiar with various patterns of the various eating disorders we've talked about. Topic 22. Topic 22 has to do with various substances and being familiar with what are the effects of these various substances. So you should know the depressants' effects on the body and the brain, know the effects of stimulants, of hallucinogens. You, again, want to be familiar with various substances and their effects on the body and brain. Topic 23. Another question on eating disorders. So we've had quite a few questions here on eating disorders. Again, I encourage you to review this material well. Topic 24, childhood disorders. So again, you want to be familiar with the various childhood disorders noted in our final chapter of review. Topic 25. Topic 25 comes to us from the chapter on substance use disorders. You want to be familiar with terminology. What is intoxication? What's dependence? What's tolerance? These are all terms you want to be familiar with. 26. 26 has to do with sexual dysfunction, and we reviewed sections about female orgasmic disorders. And you want to know what some of the data said about what women are more likely or less likely to have problems in this area, and what strategies seem to have been more favorable for women struggling with orgasmic disorder. Topic 27 comes to us from our chapter on schizophrenia. You want to be familiar with both positive symptoms, negative symptoms, the psychomotoric symptoms, a general description of what schizophrenia looks like. I have a whole host of areas where I can test you in this area, so be familiar with schizophrenia. Topic 28, stereotypes of eating disorders. So you want to know some truths about eating disorders and also some false statements about them. So I would review the reading to kind of be familiar with myths associated with eating disorders. Topic 29 has to do with substance use disorders and being able to distinguish between some of the use disorders that we discussed in lecture and also in your text. Topic 30 has to do with trauma-related disorders. So in the trauma-related section, we talked about acute stress disorder, PTSD, but we also talked about dissociative disorders. So you want to be familiar with differences between various dissociative disorders, and also if they're in any way similar to some of the trauma-related disorders like PTSD and acute stress disorder. Topic 31 has to do with schizophrenia. And this topic is aimed to understand whether you understand, if you have a good grasp on some of the statistics on socioeconomics and schizophrenia, and what might best explain this increased prevalence of schizophrenia in lower income aspects of our communities. Topic 32 focuses on the biology of schizophrenia. Specifically here, you want to be familiar with some twin studies or adoption studies, and additionally, you want to be familiar with neurotransmitters and mechanisms in the brain that seem to be affecting what we know as schizophrenia. Topic 33. This is kind of a throwback question to your familiarity with terms like correlation. So I'm going to throw some type of correlation at you, and you want to make sure you have a good grasp of this concept of correlation. Topic 34 comes to us from childhood disorders, and in this case, you want to have a good sense of the various disorders, whether it be separation anxiety disorder, ADHD, autism spectrum disorder, oppositional defiant disorder, or conduct disorder. Really is a handful of disorders in this chapter I'd like you to be familiar with. Topic 35 is a question on paraphilias, and specifically we talked about some major paraphilias. We also spent some time talking about other specified paraphilias, some of the less common ones, but the ones noted in the DSM. You want to be familiar with these as well. Topic 36, do you know the difference between an obsession and a compulsion? Do you know the difference between a hallucination and a delusion? What seems to be most common in what disorders? So again, a question on hallucinations, delusions, obsessions, and compulsions. 37, general question on sexual dysfunction and paraphilias. So a review of this material can be helpful. Topic 38 relates to use disorders and some of the gender differences found in various use disorders. Specifically here, I'm interested about the effects of alcohol on the male and female body. Topic 39, another eating disorder question. You want to know some of the consequences or side effects of having a disorder like anorexia, and we went over some of them in our reading and our text. Topic 40 has to do with gender dysphoria. We spent just a few minutes in class talking about gender dysphoria and some of the common issues associated with this condition. I would review this material and have a decent understanding of gender dysphoria. Topic 41 is classifying different substances. So you should know where cocaine is classified, or how barbiturates are classified, or how LSD is classified. So familiarize yourself with the various classifications of substances. Topic 42 is interesting question here, or interesting topic here on schizophrenia and dissociative disorders. I'd like you to kind of maybe compare and contrast schizophrenia and some of the common dissociative disorders. You should know which one I'm referencing here and understand the differences. Topic 43. 43 is kind of a vignette. That means I'll give you a slight little case example, and you will have to provide the best diagnosis in this case. So here I can go anywhere in our second half of the class and look for a disorder, try to describe it for you, and see if you can best diagnose it. I want to know if you're familiar with concordance rates, specifically concordance rates for schizophrenia. I may ask you about identical twins, I may ask you about fraternal twins, I may ask you about siblings or having a parent. So again, you want to be familiar with concordance rates as it relates to schizophrenia. Topic 45, another question on eating disorders. So again, there's more than a handful of questions on eating disorders. I'll leave this up to you to do some good review in this area. Topic 46, another question on childhood disorders. And then there's a few others we haven't mentioned here. So I've mentioned conduct disorder, I've mentioned ADHD, but a thorough review of some of the more obscure ones would be beneficial to you, like encopresis, enuresis. These are some of the disorders we may or may not have talked about in class, but are noted in your text. 47. 47 is aiming to see if you know some of the trauma-related disorders, and could you discern the difference between some of the trauma-related disorders. So I recommend a review of diagnostic criteria for various trauma-related disorders. Topic 43 has to do with schizophrenia. I hope you're familiar with the various symptoms, again, both positive and negative, and some of the terms we've used like catatonia, anhedonia, alogia. There were a handful here, clangs, perseverances. So again, I would review the various terms associated with schizophrenia. 49. Demographic information on substance use disorders. Who's at greatest risk? What segments of our American population seem to be at greater risk, and who seems to be at less risk? And lastly, topic 50, another question on schizophrenia. Want to see if you have a good picture of what schizophrenia looks like. What are the common symptoms? What is the most common type of symptoms? And again, if you review these 50 topics, you should be in pretty good shape for this final exam. So again, I wish you the best of luck on your final exam for abnormal psychology. Good luck, everyone.